Hi everyone. Thank you for watching this video about acupuncture related contraindications and precautions. So first of all, I have to apologize for not being here with you in person to deliver this class. Because by the way, by the time you are watching this video, I'll probably in Toronto having a TCM conference together with my PhD professors. So I'm really sorry about that. And feel free to reach me out if there are any questions about this class by email, by Moodle, or by any channels. I'm happy to answer all the questions for you. So today we are going to recognize various situations that require specific precaution when performing acupuncture and also other TCM treatment. For example, moxibustion, cuppings, bloodletting, electroacupuncture, using the TDP lamp, and etc. And there are also different contraindications for doing acupuncture and other TCM treatment. So sometimes we are acupuncture might not be suitable or must be avoided not to do acupuncture. So we have to recognize those contraindications. And we also have to understand the importance of the use of a thing called call button, which is recommended to have one in each individual treatment room when you are not able to be there with a patient who are under treatment. So whenever they need help, a call button is useful for them to contact you and to raise your attention so that you can provide the immediate help. And we are also going to have a brief concept of performing acupuncture in unfamiliar settings, that is outside of the clinic. Sometimes we are doing outreaching services, sometimes we are visiting patients' home and, uh, and to treat them with acupuncture. And under that circumstances, we have no control on the treatment and treatment area, treatment environment. So that might be not be a suitable or appropriate environment for us to provide acupuncture treatment. So how to fix this is important for us to practice in this special situation. And then we also have to understand the importance of respecting patients' privacy by providing a proper draping technique. So sometimes the acupuncture may involve area that are normally covered by gloves or skirt, trousers or socks or any other area that is usually be covered. So in that case, people might need to take off their clothes or their shirts or any clothes on them. So we might have to drape the patient properly in order to maintain and respect the patient's privacy. So there are medical situations that might require our precaution, or sometimes they are even not suitable to perform acupuncture. For example, during pregnancy or having different kind of medical emergency, such as stroke and heart attack. And when people are about to have surgical procedures, sometimes they might think that acupuncture may be an alternative so that they can avoid those surgeries. But in fact, we'll talk about this later. Acupuncture is not serving as a replacement of surgical procedures. We can help with those procedures, but we can't replace them with acupuncture. And for treating those patients with malignant tumor, we should also have a specific and extra precautions. And sometimes different certain areas on people's body may not be appropriate to needle. So we have restriction on needling specific areas that we might have to understand. And especially for patients who are having a different kind of bleeding disorder, we should treat it very seriously because acupuncture might cause bleeding. And when these patients are bleeding, that is going to be a problem. And we should also uh, have extra precautions when we are treating the area with broken or infected skin. And there are also other related contraindication and precautions, and we'll go through this later in this class. So acupuncture during pregnancy. As you all know that pregnant women having acupuncture is a procedure that take risk. So, and the risk is not just on the pregnant woman herself, but also to the baby in her uterus. So we have to perform with great caution. Specifically for points on the upper abdomen and the lumbar sacral region, and the point which may cause strong sensation should be needled with extreme caution, or even don't, or even contraindicated. Even we are necessary, we must use this point. It should be done by experienced and skilled practitioner. So if you don't have confidence on that, try not to use that, use those points. And sometimes beware of those point, the fact that not only the body acupuncture points might has to be cautious, but also those points, for example, ear acupuncture points, that may also induce labor or harm the pregnancy. So it is not just body points, not just the point on the meridian, but also other points. We have to be very careful about that. And there are a few points that is contraindicated at any stage of pregnancy. Well, before presenting this information, uh, every one of you should have a look on the safety handbook, and especially about the Appendix 1, which is a list of those dangerous and cautious points. And before the list, there are actually four resources that you might interested in. That is talking about those contraindications, precautions, and the risk that from acupuncture for needling those points. So the first one is from a journal called the Journal of Chinese Medicine in June 2003, and the title is The Safe Use of Difficult and Dangerous Acupuncture Points. So this part of content regarding the acupuncture contraindications and precautions during pregnancy is adopted from that journal. And apart from this journal, there are also three books that is that states those dangerous points, and and the rest of the three books is concluded on the list in the appendix. So when we go through the points showing on the appendix, we are actually um, uh, adopting from the rest of the three books. But for this presentation, we are referring to the first one, so that you may have overall concept, general, a more broader concept of those contraindication points. And those part listed on the appendix. We will go through it in the future lessons, in the coming lessons. That is specifically about the cautious point and dangerous point. Okay, let's get back to here. When we are acupuncturing pregnancy women, there are a few points that is contraindicated at any stage of pregnancy. So whenever the patient is confirmed pregnant, you shouldn't use these points unless some special situation. So basically, you can't use those points at all. They included the spleen 6, 三阴交, Li4 合谷, bladder 60 kunlun, gallbladder 21 jianjing, bladder 67 zhiyin, and the CV1 huiyin. Well, those points, especially for bladder 67, in some TCM classics, it is actually not that contraindicated, and quite in the opposite, uh, the bladder 67 is suitable to treat a wrong position of the fetus at around 32, around 20 something, the late 20s to 30 something weeks. So for some babies, some fetus, they are not locating in an appropriate position. The normal position should be heads down, right? And that should be facilitate the normal labor process. But in case if they didn't turn the position into a way that is facilitating normal delivery, so we have this is called bridge position, and the bladder 67, especially doing MOXA over this point, is said to be effective to treat the bridge position. So that works to turn the fetus into a position that is more easier for the pregnant woman to give birth. And the other points are generally contraindicated because because most of them may cause the abnormal contraction of the uterus that may lead to miscarriage. But this is just off the book that some practitioner is needling those points intentionally, especially when the pregnancy is already late or it's already over the due date. So this might be another uh, situation that you are using this kind of acupoints trying to promote the delivery. But other than that, it is totally contraindicated because especially for spleen 6, Li4, and gallbladder 21, there are many TCM classics saying that these points will lead to miscarriage. So at any stage of pregnancy, don't use these points. And during the first 3 months of pregnancy, the those points which is locating at the lower back should be avoided. That is 八髎. 八髎is not a single point, but that is a combination of the 4 points from bladder 31 to bladder 34. In Chinese, we call it 上髎. The bladder 31 is 上髎. Bladder 32 is 次髎. Bladder 33 is 中髎. And bladder 34 is 下髎, which means the upper foramen, the second foramen, the middle foramen, and the lower foramen. So we all know that the sacral vertebra is consist of one bone, which has 8 foramen on that, and this is actually four separated bone during the very early stage before delivery during of the growth development, and it eventually fused into one single bone when the baby was born. So this 八髎, 八 means 8. So, and 髎means foramen or holes. So 八髎means 8 holes. That includes those 4 points. and we have the same point on the opposite side. So 4 times 2 equals to 8. So we call it 八髎. And also the ear point uterus is also contraindicated at the first 3 months of pregnancy. And of course, if for safety, even it says that it's only contraindicated at the first 3 months, we shouldn't just for safe. If that's not necessary, try not to needle this point during the whole process of pregnancy. And starting from 3 months of pregnancy, those points in the lower abdomen should be avoided too. That includes the CV2 추구 and CV3 中极, and for example, stomach 35, 25 tianshu, or any points that is below this area, below the umbilicus, and that is contraindicated starting from the 3 months of pregnancy. And during that time, the uterus is enlarged and is getting bigger from time to time. So starting from the 5th month of pregnancy, the contraindicated point extend to the level to the CV10, that is 下脘, and CV12 中脘. So that is for 中脘, CV12, that is located 4 寸above the umbilicus. So starting from the 5 month of pregnancy, try not to needle any points that is lower than this level. And there are also one point that is contraindicated when using masturbation before and after labor, that is liver 1 dadun. So in TCM classics, this point is contraindicated to pregnancy. It shouldn't be doing masturbation no matter it's before or after labor. And according to some classics, this point serves the same purpose as the bladder 67, that's 至阴. That is also to fix the wrong position of the fetus so as to help the delivery process. Okay, the second contraindication is during the medical emergency. So whenever some emergency situation happens, since we are professionals, medical service provider, so we kind of have a professional judgment on every single incident. So it is recommended to use sound judgment within our defined scope of practice. With that being said, we shouldn't be doing any other stuff that is not included in our scope of practice. Well, of course, as far as we know, nowadays, being a TCM practitioner or being an acupuncturist, we may require the first aid and CPR techniques, and that is included when you are registered as a acupuncturist or TCM practitioner. That is one of the requirement that you have to meet before you get the license. So, first of all, we have to equip ourselves with these kind of life-saving skills so as to help the patient in case of emergency. While you're and let's say if those emergency happened in the middle of the treatment, so this is your judgment, your professional judgment to determine when to terminate the treatment and seek assistance from other healthcare professionals, and when to send the patient to a medical site, when to send the patient to the ER and to the hospital, and that is your judgment. For example, in case of stroke and a heart attack, this is an emergency situation and they require immediate action. So the first thing we have to do is to call 911 and seek immediate help from anyone. So if anyone can get help, you should get that help right away. And apparently, acupuncture must not be the sole form of treatment in this medical situation. Although after, although now you guys, as you are, you are year two students, you should be familiar with using acupuncture to treat those medical emergency. Well, in TCM classics, we do have such treatment method to treat the stroke or the heart attack in the very in the acute onset. So, but that is the way that when any else treatment is not available, right? So, if there is anything that you can do apart from acupuncture, do it first. The most First of all you have to do is call 911 and seek for immediate medical help. Okay. But while waiting for those first responder, waiting for the help from other healthcare professional, and according to your technique, according to your knowledge, you are still responsible to help the patient out. So in that case, during while you're waiting, you are still good to perform acupuncture to aid or resuscitate a patient. But we remember that shouldn't be the only form of treatment that you provide. Remember, first of all, you have to do is to call 911 and call for help, but not just treating the patient on your own. Okay. The second thing, acupuncture as a replacement for surgical procedures. So apparently, anytime we require a surgical procedure, it is probably not a simple problem that we can treat it with acupuncture uh, uh, as a single treatment. So in that case, acupuncture may not be must not replace the surgical procedure. However, when people are doing surgery or when they are re when they are recovering from surgery, there are a few things that we as acupuncturists can help. For example, in terms of helping the patient to alleviate the pain or to maintain the mobility and flexibility of the extremities, or to minimize the muscle trophy bringing out by the prolonged waiting and the passive position on the bed. Well, sometimes after surgical procedures, we are not able to move our arms and legs. So in that case, the muscle will be under atrophy, and and acupuncture is actually help to minimize this kind of atrophy. And also, while you are lying on the bed for a prolonged period of time, it is also a good idea for us to do some needling on those area in order to improve or at least maintain the circulation. So even we are not replacing a surgical procedure, we can help and assist and as an affiliated treatment to cope with the surgery. And for a patient who has a malignant tumor, again, never use acupuncture alone to treat malignant tumor because there are no research proving that acupuncture can treat a malignant tumor on their own. Well, in most of the case, they can manage the metastasis of the tumor or the progression of the tumor, but it is not a cure. So in that case, never use alone as the only treatment of the malignant tumor. And be remember that never needle directly on the tumor. So some tumor is visible. It is in the superficial area that you can literally see it. But in that case, remember that you can never needle directly on the tumor because you will further stimulate the tumor and it might promote the spreading. And also creating some kind of wounds over the tumor part may also bring those malignant cell to other area of the body, which is also contraindicated. It might spread the tumor. So never do that. But it is not saying that we can't treat malignant tumor with acupuncture or with herbal medicine. We can help in other way. Okay, just not doing that alone. Just don't treat it with as the single and only treatment method. But we can work with other treatment. We can work with the chemo. We can work with the surgery. We can work with the radiotherapy as a complementary measure to relieve pain or other symptoms, or to alleviate the side effect that is bring up by the chemotherapy or radiotherapy. Because as you may all know that those therapy, although sometimes although in most of the case they are evidence-based and effective, but they also has a lot of side effect. So acupuncture or TCM herbs in this aspect can help to alleviate those side effects. And by eliminating those side effects and to relieve those pain and to reduce those pain, we can improve the patient's quality of life. And this is what we aim at when we are needling patient with malignant tumor. But remember again, never treat malignant tumor by acupuncture as the only treatment method. Okay? And there are several restricted areas that we must not needle. For example, for infants, the infant skull has an area called fontanelle, and that part is the opening of the skull. Well, from time to time, this fontanelle will close when the bones start to develop and grow. But for infants, it is an open area, and right underneath the fontanelle, there's the brain. So never acupuncture this area because you will directly injure the brain, which is an irreversible and life-threatening damage. The second restricted area will be the external genitalia. For male and female, that is contraindicated. Okay, and also for nipples, which is well, as you know, that is a point in the stomach meridian. That is only to locate other points. That is also one points for point location, and this is contraindicated to acupuncture. And the same thing happened in eyeball. Okay, we can never acupuncture the eyeball. Okay, although we have those points that is near the eyeball, for example, bladder one, or an extra point 球后, or 鱼腰, or stomach one 承期. Those points are right surrounding the eyeball. Well, although they are still dangerous point, but we can access to it as long as you are skilled, experienced, and you are confident enough. However, we can never directly needle the eyeball because again, this is a reversible damage. And those patients who are with bleeding disorder should be applied acupuncture with great cautions or even avoid it. So in worst case, don't perform acupuncture on these patients. This might help. This might happen when people are having different kind of disease. For example, they are having lesser amount of platelet. We call it thrombocytopenia, and this is not this might cause bleeding after acupuncture. So this should be done with great caution. No arteries can be punctured, and no bleeding can happen. Because once it happens, it can be very serious and difficult to stop. And this happens to patients also with anticoagulants and antiplatelets. For example, aspirin, warfarin, heparin, those kinds of herbs is kind of having a blood thinning effect, and uh, other medication which is ended with XABAN. It's actually one uh, class of medicine which is called the XA inhibitor, and it is also one of the anticoagulant. And when people are having such kind of medication, you will expect a longer time for the patient to stop the bleeding. So we have to take it very seriously, paying a lot of attention in needling this kind of patient. And when there is, of course, the arteries should be for any reason to be avoided. But in case if bleeding occurs, and that is not a big bleeding, this patient is going to bleed consistently. So the thing you have to do is to when this happened is to stop the bleeding by applying a direct pressure right on the bleeding spot with a clean cotton ball or other clean stuff, right? And to acupuncture broken skin or emphatic skin, additional precautions are needed to needle the site who are having inflamed, irritated, or with skin lesion or broken skin. So doing acupuncture on this site may increase the chance of getting the further infection, okay, or even bringing the infection to the bloodstream, which might cause uh, other life-threatening situation, included sepsis, okay, or what we call septic shock. So in that case, it should be taken very seriously, and we have to be very cautious to needle these sites. And other situation that require additional attention is that when people are intoxicated, that is under certain kind of influence from the herbs or meds they are taking. And the second situation will be the extreme empty stomach and a fatigue or weak situation. And last week we go through the fainting, right? So this is one of the reason, empty stomach is one of the reason, or overworking, fatigue, or weak is the reason when we are fainting during the acupuncture. So this is also one of the precaution. Try not to have it before having acupuncture. And as we talked about last week, uh, when people are not having breakfast before the morning session of acupuncture, try to encourage the patient to eat something to get something in the stomach before doing acupuncture. And the same thing happen when the patient has just completed some kind of vigorous exercise, because the heartbeat is still high and the body is still exhausted. This is not a suitable timing for doing acupuncture. And it is also apparent to have a special precaution when needling patients who are having uncontrolled movement. And actually, there are a lot. of diseases which cause uncontrolled movement. For example, the most common one will be Parkinson disease, and there are also other disorder that might cause uncontrolled movement on the body. For example, the head shaking, or the hands are keep moving, or they're having some weird uh, position or weird movement on the body. So, for example, Tourette syndrome or Huntington's disease, which is kind of a genetic disease, restless leg syndrome, which somehow is an with unknown cause. There are a lot of medical situation that might leads to uncontrolled movement. So try imagine if you're needling those patients when the patient are having some kind of needles, but they're at the same time moving their extremities. So it might easily leads to the band needles, or even the broken needles. So if that's happened, you should treat it with a greater attention, or even you can consider the technique of acupuncture. You can, for example, you can needle the patient with the acupuncture needle, and without leaving the needle on the patient's body. So you just needle it and do some manipulation, and then you take it out. Okay, this is also one of the option you can consider. And when people are confused, emotionally unstable, or uncooperative, or are afraid of needle, we call it needle phobia, probably this is not a good timing for them to do acupuncture, because this might create a lot of stress when they are needling with those unconfidence and uncertainty. They will easily feel a lot more stressful, or even confusion, when they are forced to do acupuncture, which is against their will, or they are not emotionally prepared for this kind of treatment. And for patients with unstable diabetes or hypertension, uh, we should also avoid it, or needle them with great caution. Uh, the problem for diabetes patient is that the poor circulation on the extremities. So if there are wound happening on the extremities of the diabetes patient, they are healing in a slower process than normal people. Sometimes they don't even heal. So, and in that case, infection might happen, and it might become as a life-threatening case, or sometimes the limbs has to be amputated. So that's a problem. For serious diabetes, uncontrollable diabetes, try not to do the acupuncture. And for hypertension, it is also one of the contraindication medical situation, especially when they are really high. For example, the definition of hypertension is any blood pressure that is above 140 and 90 nowadays, right? So, for example, when you are having hypertension of 150 and 90, is borderline high. Well, in that case, acupuncture might still be available for this kind of patient. And it sometimes even help when, for example, when those hypertension patient came to clinic and they are having a lot of stress and headaches, and doing acupuncture might helps the patient to stabilize, to calm down, and to have a better sleep, and have a better control to the blood pressure. However, if the hypertension is getting too serious, for example, they're going to 200, 120 something, and that might be a life-threatening case, and any extra stimulation from the acupuncture may causes the burst of the vessels, when it causes the stroke. So in that case, we should take very seriously. So if the blood pressure is really high, it is not recommended to do acupuncture the unless the blood pressure has controlled well or under control. And for people who are taking steroids and immunosuppressive medicine, sometimes their inflammation reaction is being masked by those anti-inflammatory uh, medicine. So in that case, some uh, normal things will in turn becoming a huge situation. Uh, uh, Take an example, if the patient are having an infected wound, originally that is just a small cut, and people who are it, it has a healthy immunity can heal themselves without being infected or the infection spread. However, for patients who are taking steroids or immunosuppressive medicine, those inflammatory reaction is being masked or forced to disappear. So, uh, doesn't mean that the infection is not happening, or the pathogen are still spreading. The inflammation is still spreading, just that you don't have a symptom to remind you that well. So in case of having prolonged medication of steroid or immunosuppressive medicine, they will don't inflame at all. But that it doesn't mean that they are not infected. Okay? So this will easily mask the flare up of the infection, and uh, it might promote or causes the progression of the infection. And when people who are having pacemaker or other electronic implants, we also have to take care of them with extra precaution. And especially when you are performing electroacupuncture, we have to take it very carefully. Okay. So the first one will be using electrical stimulation and also moxibustion and heat lamps. So for electrical stimulation, it is contradicted to patient who are having pacemaker or other uh, electronic implants, or when people who are having seizures before, or and this patient we have to we normally it is contraindicated to electronic electroacupuncture. So even we have to do that, we can still for example, we can still use the electroacupuncture in an appropriate way. For example, we should remain the electrode on the same side, so never cross on one side of the back. For example, and in this picture, we saw uh, some acupoints being needled on the back of the body, probably in the bladder meridian, and they are applying those electroacupuncture. So as you can see, that they actually laying two electrodes on the same side instead of crossing the vertebra. So this is very important, and this is contraindicated to any patient, not just patient with pacemaker. So for pacemaker, you should never use electro acupuncture, and for normal patient, try not to perform electroacupuncture like this way. So, but that is theoretically, and in reality, just off the book, some experienced acupuncturists or professors, they will do it intentionally. They will place the electrode across the vertebra intentionally. and that is a special situation to treat the spinal disease. Well, but it's not recommended to you for you to perform it unless you are well trained, you are experienced. So for now, don't do that. Okay. And before using the device, check before each treatment, and clean and disinfect the required surfaces prior to the treatment. And remember, before use, you have to zero out all the dials because these dials, when we are repetitively using this kind of machine, sometimes we are getting busy, so we forget to turn this back to zero. Well, these are the dials. Normally, we have 6 to 8 dials, and each can be adjust about the frequency and also the magnitude of the electric pulse. So sometimes when we are using this kind of machine, uh, of course we have to turn on the switch first, right? And then we set a time, and then we start to adjust the magnitude of the pulse. Okay, but when we are done, when the treatment is completed, some practitioner, a careless practitioner, will just switching off this machine without zeroing these kind of dials. Well, in terms of switching off the machine, it kind of work, but it will have a risk for the next patient who are using the same machine. Because when you are not zeroing the dials, the first time when the patients are ready to be stimulated, they have the clips on, they have the machine on, and once you turn on the machine and you turn on and you set the time, uh, for some models of the electrical device, they will have current right away, and uh, that might be already too big, too strong that the patient can withstand. So be remember to turn it back to zero after before treatment. By having said that, it means that we have to check before turning on the device. And remember, when you are adjusting the intensity or adjusting the magnitude of the pulse, try to increase it gradually, but not right away. Okay? If you are doing too fast, you will probably miss the intensity that the patient will gain effect without having an tremendous pain. Because when the magnitude is getting too big, some people may feel painful, or sometimes they will even dizzy or having other side effects. So this is not recommend for the stimulation to become too strong that people start to feel painful. And remember to monitor the patient to prevent neural injury. So if there are persistent stimulation or the patients feel unwell, stop the stimulation immediately. And also you have to consider the time requirement of the treatment. So it is not recommended for prolonged and unnecessary treatment. In most of the case, it might only last for 20 to 30 minutes. And again, remember to set the dial to zero before switching off the power. This one, number one, to preserve or to maintain the quality of or the functionality of the device, and the second is also helping the next practitioner, to avoid the overstimulation for the next patient. And when people are getting older or frail patients, use additional precautions. So don't do it too quickly, don't do it too strong, and you have to be very careful. And all electronic devices, if we are using 110 voltages, please don't plug into the outlet directly. Instead of put it directly, plug it into a surge protection the bar uh, as an intermediate, such that when something comes up, the protection bar will suffer. The fuse will suffer first. Will cut off the electricity. And inspection of those devices with a regular basis. So check them from time to time, see if they're still working or working properly. If not, you have to replace it. All right. And for masturbation, remember, don't never left patient unattended at any point during treatment, especially when you are doing masturbation with those boxes. Never leave the patient and unattended, because anytime when patient feel too hot, you can adjust. But when you are gone, patients are likely to be burned. They are have they you will literally harm or burn or injure the patient. So don't do that. And be cautious when treating pregnant patient, because especially for the points on the abdomen, and also those contraindicated points that we have mentioned before. And be cautious when doing masturbation near the mucous membrane. Normally, we don't use masturbation during the mucous membrane, especially for eyes and for mouth. We don't do masturbation at all. And those particles that is coming out from the burning from the masturbation is going to stimulate the mucous membrane. So it is generally uh, not recommended to do the uh, masturbation near those area. And also be cautious when treating hypo or hypersensitive patient. So for hypersensitive patient, a small stimulation is too much for them, and vice versa for the case of hyposensitive. Sometimes they might become more they might receiving too much stimulation without realizing them. Okay. So that might be inappropriate, or it may even harm the patient. For example, when people are have or when unconscious, they don't react with the overuse of masturbation. When they are getting too hot, they can't respond well, and that might burn the patient's in skin. And also don't do that over the main arteries and organs on the face or other sensitive area. It is not recommended. Although sometimes if you necessary, you can still do that. For example, to muster the do 20, it is still good to use, or do 21 or something. But be cautious, be careful. And if you are doing scarring masturbation, evaluate the necessity before performing. Well, nowadays, not much people will do scarring masturbation unless you want to show your patient your genuine understanding of TCM masturbation. And other than that, the normal masturbation is more preferable nowadays. At least you don't create a scar or put the patient in risk of infection. So try to think about the necessity of doing such kind of aggressive treatment. And remember to swab the skin before performing acupuncture after masturbation, because there are a lot of ashes left behind. So remember to clean before doing acupuncture. And if you are really want to do the masturbation in your clinic, be remember that you have to prepare certain kind of fire extinguisher and fire blanket and anything that might helps uh to stop the fire in case there's happening. Okay? So you can never expect or estimate the happening of the accident. So, but having muscle suppression is a kind of risky treatment because you are going you are it's possible for you to burn the clinic down, right? So be remember to have this device or equipment readily available in your clinic. And be very clear and explicit with patient, especially when doing direct masturbation. That is, uh, you are applying the muscle uh, directly on the skin. Remember to ensure the signed consent of treatment and help the patient to identify possible risk of the patient of the procedure. And obviously, the most important risk will be the burn on the skin, burning skin, right? And also, the same caution has to be processed when you are using the heated needle method. And try to use a disposable heat shield under the needle. So by using this kind of heat shield, even the ashes from the masturbation fall off on the patient's body. There are still some barrier between the patient's body and the ash, and it might prevent the burning from happening. But in case if there are burns, be prepared for this kind of medical situation. Well, for severe burn with a large blister may have to be seen by a physician for sure. But for small blister, you can protect the lesion and allow to heal and no need to puncture. Remember, no need to puncture the small blister. That is only applying to small blister. Okay? For large blisters, sometimes people will feel so much pain, and you might want to puncture the blister in order for the blister to heal more fast. So when you are going to puncture the blister, we remember to perform proper hand hygiene at the very first step, and then to disinfect the blister area with appropriate disinfectant, for example, the alcohol and and then puncture the blister with a sterilized needle and then drain the water in the blister hygienically. After that, apply appropriate dressing of sterile gauze on the area. Try to cover the area and keep it clean and dry. And if needed, if it is too big for you to handle, see a physician as required. So one more thing is to use the use of heat lamp. So the use of and remember to use the heat lamp according to the manufacturer's instruction, and also to monitor the heat lamp so that to confirm that the lamps are operating in a certain distance that will not burn the patient while having an effective treatment. And also, remember, it is contraindicated to patients who are having some implantation made of metal. For example, when people are broke their legs and there are some metallic implantation on the femur or tibia, it is contradicted to use heat lamp because it will eventually heat up the metallic implantation and might burn the tissue from the inside. So generally, it is contraindicated, right? And use of call button. The call button is used to notify the practitioner or staff or of any situation that require rapid response. For example, when the electroacupuncture stimulation is getting too strong, or the heat lamp is placing too close, or it is too hot, or the patient feeling discomfort, or it is not in a comfortable position. For example, when the people are not relaxed, they are stretching some kind of muscle. So from time to time, people will feel discomfort, and this will be magnified if they are needle when they are needling. So it might leads to fainting or other complication. And or patient need when patient need to use the washroom during the treatment, sometimes you have to take away the needle earlier in prior to the completion of the treatment because they are just want to go to washroom, and this has been accommodated. Okay. And some patients are embarrassing. They don't bother asking for help from the practitioner because sometimes they know, oh, the practitioner, you are so busy, they don't want to bother you, or sometimes they just don't want to shout out loudly. So in that case, a call button can help them to overcome this emotional barrier. Well, if it is not used, there are two things you can do you can consider. One is to stay in the treatment room throughout the process, or two, regularly check on the patient at frequent intervals. For example, 5 minutes to 10 minutes. Make sure they are okay during the treatment. And in that case, you might not need a call button. Otherwise, it is recommended to use it so that the patient can reach you out immediately when they need help.